Well, good morning, everyone. Beautiful morning, and welcome to I believe this is I've actually lost track, but welcome to our task force meeting. I don't know whether this is our 6th or 7th task force meeting, but
we're 7.
We're 7, thank you. All right. Well, thank you all. Thanks for your continued work. I know this is a big effort and a lot of work underway. And so we'll go right ahead and jump right in to updates from Mayor Schewel and Chair Jacobs. And who would like to start us off today?
I'll start today. Wendy, is that good? Thanks. Hey, everybody. Great to see you. Thanks for all the good work that everybody's been doing. I look around this table and I just see everybody's face reminds me of all the good things that have been going on. And I know that Wendy shares my appreciation for all of you all. I do want to start, as usual, with an update on the latest order from the governor. I think that you all know the two main things that have been changed in the governor's order. One is the face covering requirement, the statewide face covering requirement. It's not as comprehensive as ours, but it is good and important. I was really pleased to see that, and also felt, to be honest, quite, as I think Rod has expressed before, proud of Durham that we were out in front of this, and I'm really I'm glad the governor followed suit. And then the other thing is the delay of any more reopening for at least several weeks. And again, I think this was a really good decision, and I think the governor needs support for this decision. It wasn't an easy decision, so I think insofar as we need to be publicly supportive of this because it's critically important for the public safety of our state. Our Latinx cases continue to be our most important concern. Of everything that's happening, we continue to have just such a high number of cases and a high percentage of our cases in the Latinx community, and I know we'll continue to talk about that more today. A lot of good work is going on in that regard. I was on the Immigrant and Refugee Roundtable call yesterday, and they have some requests they're going to be making of the roundtable. Pilar and El Centro and many others are making big efforts in education, and I believe I'm going out this weekend with someone from El Centro to some of the Latinx businesses to talk to them, and I'm looking forward to that, Pilar. So thank you for arranging that. Our Back on the Bull campaign, which Marielle and many others, McKinney, Ryan, so many others have been working on, will be having a soft launch. I believe now that the time is early next week to begin rolling that out so that we can sort of test it initially, and then it will be fully rolled out very soon thereafter. And the online marketplace for PPE, this was really a concept that Ed came up with, and the online marketplace for PPE, which Ed and Pilar and Ryan and others have been working on, will be rolling out next Friday, we believe. That's the aim. And Susan has a great list of local providers of PPE, and we need everyone who knows local providers. We want to especially highlight our historically disadvantaged businesses as PPE providers, and they will be highlighted on the website. I think that there's a lot of work that we've been talking about in terms of how to get face covering compliance, not just among the Latinx community, but also in general. And that we've been talking a lot about how to do that. And one of the things that we feel will be coming up in next week when we do an amended order, which we haven't done in a while, is requiring a sign on businesses that will mandate, that will let people know about the mandate for face coverings. That's going to be important, but not enough. As Marielle has said many times, if we mandate something, we have to have some system of accountability, and she's been giving a lot of thought to how that might happen. And we'll need to figure all that out together. The Small Business Fund has launched, and that's great. And the county has added another $1 million to that. Thank you so much to our county commissioners. There's a digital equity fund that Geoff is co-chairing that drive, and that will be launching soon through the Durham Public School Foundation. All these are COVID related and critically important. Our End Hunger Durham continues to be feeding hundreds of low-income seniors every week. All this is great work and really, really important. One thing that I think we need to do as a task force is we need to figure out together what are the important financial priorities that we have. We know that there's a communications plan in the works. We know that there's the need for, there may be more need for PPE that we need to provide. Do we need to support sanitarians or COVIDians, as I like to call them, who will be helping us with educating people about compliance. There are other needs that others of you all have identified as well. And I do think that one of the tasks that we need to take on in the next week or so is to get, and I've discussed this with Ryan, is to get a budget together now that we know what some of the financial needs are. Both the city and county have committed funds to COVID relief. And I think it's time for the task force to figure out what our costs might be that we need to be working with the city and county on. So there are other things as well, but I did want to just outline some of what I think are some of the most important work going on. Great work also I didn't mention by the communications task force that Susan is heading up. So I'll stop there and turn it over to Wendy, but again, I want to express my gratitude to all of you.
Well, thank you, Steve. Great report. I think there are a lot of great things happening, and that we need to acknowledge that and stay focused on that as well. And I just want to add that, you know, it's fantastic that the governor has done a statewide face covering order. I think this is really a big step for us because Durham has had one in place since March 28th. When I did our first order, face coverings were required from the beginning in Durham. And, you know, we've seen, you know, Orange County and Raleigh follow, but it's just going to be so much easier, I think, for us. It'll really help support our efforts here. I want to acknowledge, though, that the governor's order really puts the onus on enforcement on our businesses. And so I think that the timing of the soft launch of the Get Back on the Bull campaign is actually fantastic because we really need to figure out how we can support our businesses and our employers being in this role. And so I'm really interested in us talking about that and hearing from the roundtables over the coming week in conversations with the roundtables. I would really like to hear from the business community how they feel now about being really put in this role of the enforcer, and you know, what can we do to help support them as a community. And again, I think as Steve mentioned, having some type of uniform requirement around signage, even helping to financially support that, and you know, our overall campaign around compliance and will, I think, as a community, I hope it will help support our businesses in this role. And of course, the win-win is that, you know, if the way for us to ultimately get back on the bull and open up is by keeping our numbers under control, the rate of spread. And we know that face coverings are really, really tied to that. I think on the good news side also, Rod will talk more about this, but when I look at the numbers now, what I'm seeing is that Durham's numbers are leveling off and trending down. I'm talking about overall rates. The information from Duke this past week was that our rate of infection was 17%, whereas the state's rate was 20%. And then Rod will talk more about this, but our 7-day average also seems to be, it was 67 cases, and the week before it was 80. And so when you look at this, some of the data, it looks like we're starting to level off, and if not, slightly go down in terms of the rate of increase. Of course, the cases are increasing. We know that, but we still have to look at those rate of increases. And as Steve said, our real concern is we've got to get a handle on what's happening disproportionately in the Latinx community. But I think it's important to acknowledge what that trend is. And I attribute that to the hard work of, our contact tracers, all the testing that's happening, and just people being compliant in our community. So I think it's really good. Steve touched on some of the bigger picture things happening, and I want to share a little bit more so that yes, we approved $1 million to contribute to to add to the 2 million from the city and Duke to support our small businesses. We are also, the county is pursuing an EDA grant, a $240,000 grant, which Geoff is very involved with, to focus on getting our residents back to work. When we look at some of those economic, data points, and looking at our unemployment rate now at over 9%, we need to be thinking right now about how we are going to direct people into the great jobs that we have in Durham. And on another good note, the county just approved a economic incentive with Grail, which is a company headquartered in Silicon Valley that is going to open a manufacturing site in Durham with 739 jobs over the next 7 years and $111 million worth of investment. This is actually our second economic announcement during this pandemic. We need to really take a moment and appreciate that we are in a community that in the life sciences and biopharma, we are continuing to grow. And so our challenge as a community is getting Durham residents retrained, our high school graduates in the pipeline for these jobs. So we're applying for a grant. We committed $60,000 as part of our 2080 match that will create an aseptic space that folks have identified. But there's an initiative going on called the Bulls Initiative, and we want to focus on minority residents and the fact that and getting grants to people so that they can go to school and recognize that it needs to be a job for people to go back to school and to get the biowork certification that we have at Durham Tech. So I wanted to just keep that in people's minds about the larger framework. In terms of the food issues, Steve mentioned that we have the summer feeding program going on right now through our library and our seniors. We've got volunteers signing up through the Triangle Nonprofit Center to help with that. Housing, the county, as of July 8th, our contract ends with the hotel that we have. We're moving people back into urban ministries, but only at half the population. because we have to social distance. And we are looking at we put out RFPs, and we're looking at those proposals of how we meet the needs of our homeless population. So, so a lot of great work is going on with the city and the county. And I do encourage, Steve referred to this, that this task force begin to start making some very formal recommendations to the city and the county, and make sure that we're closing the loop back with things coming out of this task force back to city and county leadership and also staff. So thanks again, everybody, and I look forward to more discussion today.
Thank you both for those great updates.
And
a lot going on. Yep.
Just want to mention, I am going to be doing double duty and going to a vet appointment. So I will have my screen on and off, but I will be listening the whole time.
Great. Thank you. All right. In terms of co-chair updates, I have a brief update on the face coverings work. First of all, I want to thank Ed for his leadership in this area. He's done a phenomenal job of pulling this together, and we are working to launch a website for businesses in the next week or so that will be sort of a marketplace for face coverings, and really focused in on local small businesses, minority-owned businesses, women-owned businesses that are making face coverings. Ed, anything else you want to mention briefly on that?
No, I think other than maybe there's, if we can figure out a way to broadly get that word out to some. I mean, we're all kind of individually kind of hitting channels, but I know there are still pockets of people who are engaged in making masks that have no way we have no way to get to, and I would love to get them included as well.
Okay, we can work on that. Thank you. Maticia, did you have any updates, additional updates?
Yes, so good morning and happy Friday. As usual, it's been another busy week for the task force, for the members of our community. I just want to say again, thank you, task force, for all the great work that you continue to do. As you heard from Mayor Schewel and Commissioner Jacobs' update, there's still a lot of work for us to do as a task force. As you think about Governor Cooper's recent announcement, and as you hear the metrics that Rod will talk about, it definitely demonstrates we still have a lot to do. So definitely looking forward to continuing the great work that we've started. I will give two quick updates. One update related to community engagement. Lois is not with us today, but she did ask that we share with the task force the great work that they've continued with in the community letter information flyer that you've seen in your materials. And we have a link to those under the Back on the Bull campaign section. But she wanted us to emphasize that if you would continue just to highlight the letter, the flyers to your networks, make sure that you're sharing the information so we're getting the word out about what we're trying to do and the impact that we're trying to have on the community. She also shared that the Neighborhood Improvement Services staff has actually begun distributing the flyers broadly through their events and networks. And they will continue to get the information out to the folks that they're engaging with to ensure that we can continue to educate folks on the Back on the Bull campaign. Another item that I do want to highlight, it's not listed on the agenda. Of course, we send the email out to ask for agenda topics, and I think it was Dr. Akinboyo made a recommendation that we have some conversations around Durham Public Schools and how the task force can actually influence what the Durham Public Schools may be thinking about doing. But Durham Public School leadership actually reached out to the task force, and they've requested a meeting with us, and they requested this meeting because they truly want to better understand our local orders, and they want to understand how they take into consideration those local orders as they go about doing their planning. So we're working to get some time scheduled with Durham Public Schools so we can initiate those conversations. And once we have those conversations, if there's information that we need to bring back to the task force, or if we need the task force to engage more broadly, we will bring that back and have a conversation around that. So looking forward to those conversations with the Durham Public School leadership team. So with those two updates, I think I will transition it over to Rod to give us an update on some metrics and another item that came out of our last meeting related to congregate living facilities and nursing homes.
Good morning to the members of the task force. I too extend my debt of gratitude to you all for helping public health to spread the word about COVID and to help our community. We certainly are appreciative of being on this task force, and we certainly appreciate each and every one of you. If there were a headline I could give you, I would say it would be Durham leads the way, sees improvement, has more work to do. That would be the headline. As of this morning, we're sitting at, nationally, we're certainly sitting at 2.3 million, way over 2.3 million cases of COVID, resulting in 121,809 deaths in the US. Within North Carolina, 57,183 cases of COVID, resulting in 1,290 deaths. In Durham, we are sitting at 3,403 cases of COVID overall. However, there are only 547 active cases, 2,868 inactive cases, meaning just that many Durham residents have recovered from COVID. And we had our first death related to COVID in about 9 days. As of yesterday, an individual who was, ironically enough, in a long-term care facility, over the age of 65 with a myriad of comorbidities. So as always, our hearts and minds definitely go out with that family for their loss. Continuing on, as mentioned, the cases continue to increase. As of Monday, June 22nd, we had 3,266 cases, which did represent a 766 case increase from the previous week. However, our 7-day moving average was down. It was 67 cases, which was down from 80 last week and 80 the previous week. So again, the 7-day moving average definitely tells us whether or not there's an increase or a decrease in our trends. And that is positive for the most part. But again, the numbers continue to tell us and paint that picture that more work needs to be done in terms of COVID. As mentioned, the Duke data did indicate that while North Carolina's trajectory and rate of infection overall is 20%, Duke's rate of infection is 17%. So we clearly know, based upon the governor's orders, that North Carolina's trajectory of lab-confirmed cases continues to increase slightly. Hospitalizations, however, continue to increase greatly. Durham's trajectory of lab-confirmed cases over a 14-day period, 2-week period, sees a level of flattening. So we're encouraged about that. We continue to keep a foot on the gas pedal and do whatever we can to promote awareness of COVID. In terms of race, ethnicity, and trends, once again, our Latinx population, as mentioned, represents 77% of our cases for the month of June. They continue to be overrepresented, whereas Black African American represents 10%, underrepresented, and our white Durhamites very underrepresented with 12% of our cases. And they represent the bulk majority of our residents here in Durham. As far as occupational settings, we continue to see high cases in unemployed individuals, construction, and janitorial services, all coming from the Hispanic or Latinx community. As far as the unemployed, they represent the Hispanics at 84%, and 83% of those individuals were female. Construction represents 92% of our cases, 91% being male, and janitorial services representing 90% of our cases, and the data tells us that they're 93% female. In terms of surveillance, we just want the task force and community at large to know that we are certainly monitoring community spread and close contacts, as always, as far as our surveillance says. But of note, there has been an increase in community spread percentage over the last 2 months. Initially, for the month of March, the majority of our cases were related to travel, Duke student travel, just student travel, and healthcare workers. The month of April kind of turned more toward close contacts. And recently in the month of June, May and June, we're seeing community spread, with May's numbers being 33%, and June dipping down a little bit toward 30%. However, we still have a few days left, so we'll continue to monitor that. We're also seeing an increase in number of cases that are lost to follow-up. And what that means is our contact tracing team, they do 3 to 4 contacts. And if they are not able to receive any answers or any information, then we have no other choice but to discharge that particular situation. I'd also like to mention to the community at large and to the task force that on Tuesday, we did receive a visit from Secretary of Health and Human Services, Dr. Mandy Cohen. She decided that she wanted to come down to Durham, and we were her first visit on a number of different visits that she has planned to different health departments. We took this opportunity to introduce her to all that we're doing. We let her know about our emergency operations apparatus, and let her know that we are in well over 100 days of emergency operations. And we were able to really give her a bird's eye view of our data that is well represented on our data hub. And she being a very, very intelligent doctor, really appreciated the data that we were able to present. It was described as robust. It was described as very, very detailed. And in fact, she requested more information to be sent to her after we left, which we complied with. She did find the visit to be enlightening, and we're certainly appreciative of her being able to see all the hard work that has gone into this effort, not only by just the emergency management team, but also public health team and community at large. We were also able to highlight the Recovery and Renewal Task Force and letting her know that this task force endeavors to provide the mayor and the chair of the Board of Commissioners with in-depth information for all communities and all sectors of our businesses. So again, she was really delighted to receive that report, and we are happy that she came and visited us. You will receive some additional information about our testing strategy and progress being made from our Vulnerable Populations Work Group report out in a few minutes. But again, that pretty much concludes my presentation. And as mentioned, I'll just reiterate that highlight would indeed be that Durham is most certainly leading the way. As Chair Jacobs says, since March 28th, we did have face coverings in every one of our orders. In my weekly message and weekly address to Durhamites, I also encourage them to utilize face coverings and use them correctly. That means over the nose and over the entire mouth. And we certainly want to continue to hone that message now more than ever. And as mentioned last week, I've had several health directors throughout the state of North Carolina to reach out to me personally, wanting to know how Durham did it. Is it in our order? Did we have issues with compliance? So I was delighted to let them know that, to remind them that Durham leads the way. And I was also able to let them know that if you were to do it from the start, you wouldn't have much difficulties now. That concludes my presentation. More than happy to answer some questions and then go into some information about long-term care congregate facilities.
I have one question. Could you just to clarify for us the difference between when we talk about community spread versus close contact, what that difference is for people?
Absolutely. Thank you so much for that question, Katie. Community spread is when someone is getting COVID and for the most part, they're not a student, they're not a traveler, and they have had no known contact with a positive case. So as a result, for the most part, when community spread begins to creep up and the percentage increases, that means that we have a lot of individuals who are getting COVID and they cannot determine exactly why that happened. Whereas close contact would definitely be that person who was in the proximity 6 feet or less for more than 15 minutes as described by the CDC. And they have gotten COVID and they can clearly identify and remember, like, I was with so-and-so and such, I remember it on this day, and I remember that person had some maladies, and I think that's where I got it. So I hope that answers your question.
It does. Thank you very much.
So just one other quick comment. As always, very impressed with the summary. The earlier comment about, so Duke data essentially is Durham data. What we share and what's summarized is just what's going on in the community. It just so happens that a Duke person sent it. And I know what you meant, but I wanted to make sure it was clear to everyone on the call that it's Durham data. The numbers are for Durham because Duke has a larger catchment area where we see patients across the state, but we focus on Durham data.
Thank you.
As requested last week, I'd like to just really briefly highlight our efforts around long-term care facilities, nursing homes, as they're sometimes called. If you will recall, probably a few months ago, there were long-term care facilities throughout the nation that had seen high cases. And it's because of the congregate lifestyle. You have some facilities that have residents in very, very close contact. And seeing this and really heeding the call for action, our Emergency Operations Center under the Public Health Branch, which I'm the lead, we formalized a long-term care facility strike team. Some of the things that we've done is we did reach out to the 22 long-term care facilities in Durham County, and we had educational webinars set up, which were recorded. And we wanted to make sure that they were able to have access to it, to participate, to have their questions answered. But more importantly, they had access to the recording to be able to go back and to extract pertinent information. That long-term care facility strike force is headed by a public health nurse, a seasoned senior public health nurse, and a registered sanitarian. And what we do is we go on site and we make sure that we are able to provide tons of information to make sure that they can, have the place sanitized, make sure that they can segregate positive cases from those people who are COVID negative, and really make sure that their staffing is adequate. We also provide a lot of information and consultation in terms of those administrators and directors of nursing, so they can always know that they have someone who they can rely on. We've provided tons of information in terms of isolation, i.e., just to give you a quicker example, if we know that there are positives inside a long-term care facility, we highly recommend that they separate them and segment them from the well side as soon as possible. We make sure that they have those parameters in place to keep the rest of the residents safe. Additionally, PPE conservation is huge. The state of North Carolina has provided tons of resources in terms of PPE for our long-term care facilities. So if they in turn decide that they need what we call a pushback, then they get in touch with us in emergency management, and then we make that request for them. Once it became more of a nationwide issue, then the federal government, under the auspices of CDC, did take it upon themselves to begin to push PPE to long-term care facilities in every county. Additionally, I have personally been on site at several cases of long-term care facilities to date. I think I've been to 3 on site, full PPE, gown, mask, face shield, the whole 9, just to make sure that they can see public health leadership. More importantly, to let them know that we care, let them know that we're there. I am so grateful for the partnership of Duke University Medical Center, particularly Dr. Cam Wolf, who has really, really done a phenomenal job of being that point of contact, not only for Durham County, but also for Orange County. And Duke has gone in and done mass testing when necessary, because per the guidelines from the state, if you do have 2 or more confirmed positives, the recommendation is to test the entire facility. So again, we certainly appreciate the partnership of Dr. Cam Wolf. He's done a phenomenal job and continues to do a great job. But we continue to request that I've personally made the request of long-term care facility administrators to ensure that their staff is not what we call moonlighting and working from one facility to the next. It was a recommendation and not a directive. Just want to be careful in saying that. But we do know that a lot of the transmissions occurred from employees who worked at multiple facilities. I do know that the mayor and the chair have received letters from time to time, and we've done our best to really act on every one of those letters, because again, this is a vulnerable population, and at one point in time, they represented the majority of our cases. So we had a very strong call to action. And as reminded to our EOC apparatus on yesterday's 1700 hours calls, we're not out of the woods yet with long-term care facilities. We still have a few outbreaks. And again, they're nothing massive. We are handling each and every one of them, but we continue to ask them to be vigilant in all that they do. I'll be more than happy to answer any additional questions you may have around long-term care congregate facilities.
I have a comment, Rod, which is, thank you. Your work has really paid off. As you mentioned, when we first got started, we were seeing the great majority of our cases, and we've had some terrible outbreaks. And the work that you all have done, and that the long-term care facilities have done with your guidance, has really made an enormous difference. I mean, we're not seeing nearly the outbreaks that we had, and I just want to appreciate that and thank you.
Thank you, Mr. Mayor. Katie, I turn it back over to you.
All right, thank you. And I will turn it right over to Marielle, Susan, and Ryan for an update on our Back on the Bull campaign, which is really exciting. So I will turn it over to all of you.
Great. We haven't coordinated to who wants to go first, so.
I think you should, Marielle.
Great, sounds good. So sorry, I have my video off. My Wi-Fi is a bit spotty and unreliable, so I'm trying to keep my video off to keep the sound going well. So as Mayor Schul already sort of previewed, we are very excited about the soft launch process so that we can really test and tweak and figure out where it breaks, because it's actually a very complex website with a lot of delicate intricacies where, there's a million different ways that people can complete that checklist. And then the PDF that's generated can be a million different ways because it depends on what people are saying. And so, we just want to make sure that there's no crazy bugs in that. Plus, the added, even if somebody completes the checklist in English, We want to make sure that it populates the PDF in Spanish and English, and same vice versa. So there's just a lot of sort of back end delicate places. So we're excited about having some of that time and breathing room to, see if we can to make sure that all of the programming and logic is holding up, because there's a lot of delicate moving pieces. So we're excited about having that time to make sure once it's live to be doing that testing and tweaking. And we're then incredibly excited to start pushing it out and getting businesses to start taking it. And I think there's a couple of ways that would be incredibly helpful for folks on this task force to support that. As we're getting ready to roll out. One is that we're still continuing to add resources. We have that resources page. And currently right now we have, the FAQs on the stay-at-home order that will, update as we get more information on and changes in phases. We have the county data hub link so that folks can go and see that great data that Rodney's been talking about. We have the WHO's Mythbusters. So, what do we really know about the coronavirus? We've got a lot of different resources. We will add the marketplace when that goes live to it as well as an option for where folks can find PPE supplies. But if there are other resources that you guys have come across that you think are just really phenomenal, please send them our way and we can add them to the website. We just need the link for it, and we can then handle the, what we want to call it on the resources page, the description of it, and then the translation of those two things into Spanish. So that would be a key thing. And then the second thing is starting to think about now and start to compile, and Susan can talk to this a bit more, but how are the different ways that you or your organization has access to people and to businesses? Because we want to make sure that we're pushing this out to both Durham individuals, but also to Durham businesses, of course. And so that's thinking through, are there listservs? Do you have access to large groups that have large followers on social media? Because this is going to be a major effort to try to reach as many diverse groups within Durham as possible. And so, we're going to get really creative in thinking through those things. And Susan and her team have done a great job at starting to pull together that list. But one of the benefits of this task force is that we've got a great diverse group of folks on this call that are involved in many, many different groups in Durham. And so really being able to pull and leverage that knowledge to reach as many households as possible would be great. Anything to add, Susan or Ryan?
Well, to talk a little bit more about some of those outreach efforts. We are very excited about the website getting ready to roll out. And one of the things we're doing is, I think on a previous call, we have members of our communications committee who have assigned each one of their roundtable groups. And what we're going to be doing is actually reaching to them before we go with the website and asking them to complete the checklist. And I'm going to turn my video off to make sure, because I'm getting a message here. So reaching out to these roundtables and asking businesses to go ahead quickly and fill out the checklist so that when the website is officially launched to the public, we already have businesses listed on it. And this is part of encouraging people in Durham to embrace it and see how important this is. We're planning for the week of the launch week to be the week of July 6th. So that gives us a few days between now and then to make all that happen. So there'll be a lot of activity going on behind the scenes. And we will be planning a press release. We have some media ideas that we would like to be able to pursue. In addition to all the different channels that Marielle was referencing, we are leveraging all the listservs and social media channels we can among communications team members. And so we need, as she was saying, to leverage all of yours as well if you have opportunities for messaging to go out. Also, we've called on some of our places, local venues and places that have outdoor digital signs to put messaging out on those. So we are trying to, and we're talking about neighborhood listservs and things like that. So trying to leave no stone unturned, and you all are a part of that. So we will be feeding you all information that you can use, that you can post into your social or business and organizational channels. Ryan, anything I can turn over to you?
Sure, I'll back clean up and just express gratitude. I mean, I think you all know this, but Susan and Mariel, so Susan's team, we have dozens of people behind the scenes who have been putting in hundreds and hundreds of hours, all volunteering to get this up and running. As Mariel said, it's a complex and well thought out thing that's being done, and just the level of kind of talent and expertise that's gone into it, the hundreds of hours of people who are working very hard to get this up and running. I just want to express my gratitude to everyone who's making this happen. And I think you all said all the right things. I just wanted to say thank you.
Thanks, Ryan.
And I would just note it's been great for me and my team to be able to focus on getting the website up and ready. And Susan's team has been absolutely phenomenal in thinking through the distribution channel of that. So I just want to give an extra bump to that.
Susan, if I could, Geoff over at the Chamber. It seems to me that there's we're asking, this is broader than just business. I hear we keep on referring to be asking businesses to sign up and post signs, but it seems to me the right language is probably something along the lines of establishments. We're not exclusively asking businesses to do this. We're going to be talking to governments and nonprofits and other kinds of offices. So I would encourage this group to start kind of focusing around that phrase instead of just businesses.
Okay, thanks. That's fair.
Yeah, that's great. And Geoff,
Just
it's
to
true
second
that
that.
our places of worship are also going to be using this tool and are excited about it. So thanks for that. That's a good call.
Yeah, and just adding to that, we were on the Childcare Call as well, and just to ensure that this applies to a lot of other places. So this is stellar work, and everyone should realize that they can use all the resources that are created.
And the other thing that I'll also note is that, I've kind of lost count, I think maybe 9 different establishment types, the checklist that will be ready at the, when we push out. And then it's very much built in a way that should make it easy for us, or at least easier than in many other ways it could have been built, to continue to add checklists from organizations or establishments that don't see theirs represented, and that there's sort of sufficient demand for it to be created. So, that's, I just want to kind of put that out there, that we have that ability. We sort of had to put a little bit of a limit on adding more checklists at this moment, just to make sure that we could get it out the door and ready to go. But then once it's live, it'll be fairly easy to add additional checklists. So as you guys sort of talk to more groups and folks who are saying, oh my gosh, we want this for us, we will add them to the queue and then be able to start doing that once we've gotten everything else done that needs to happen for it to be recruiting businesses in.
And one other thing I want to call out is the work that Pilar has done on bringing the Hispanic media in and really making this push a true bilingual push. So that has been fabulous and very effective. So we appreciate all your work on that, Pilar.
Well, this is really phenomenal work. I also want to express my thanks to all of you. Just an incredible effort in very short time frame. So really, this is really exciting, and I can't wait to see it launch. It's terrific. Any other questions for this group before we move on? All right, so next up, we want to talk about the update from our vulnerable populations or vulnerable communities action team. I can maybe start us off by talking about the work with the homeless, and then and brief update on testing, and Phil and Pilar can add in. And Pilar, I'd love to hear more about the work outreach we're doing specifically with the Latinx community. Just a brief update, and I think Chair Jacobs mentioned this. So the contract with the hotel in RTP that has been providing temporary isolated housing for those from urban ministries does end July 8th. And so work is underway around looking at isolation, monitoring, and testing for our homeless population. Work is underway around sanitation stations for around the city. And then the county does have proposals for temporary housing for medically vulnerable homeless residents. And so that work is underway. And then also in terms of face mask or face covering distribution, we've got good news that the Care Clinic, which is another clinic that serves the underserved in Durham, has also received an allocation from FEMA and already has put 40,000 of those into circulation. So an additional, when we're talking about how do we distribute broadly to those most vulnerable in our community, that is in addition to the allocation the county has from FEMA, as well as the allocation from Cover Durham. So really good work there. And then brief update on testing, continuing to work with the two trusted sites that have been identified, El Centro, of course, as well as Holton. And Lincoln has a clinic at Holton already. So Holton should be relatively easier to get set up, I would say. So work is underway around the logistics of that, and then also looking at additional opportunities for even beyond that expanded testing. So Phil, anything that I missed there?
You did a good job of covering what we went over, Katie. Just wanted to add that we continue to ramp up our numbers. So to give you the perspective on the data from a safety net viewpoint, last week, 50% of the individuals tested were positive. Of that 50%, all of the positives were Latinx. So, from our perspective, that vulnerable population perspective, it's always challenging to make sure that we're reaching that community. And I know all of the efforts are ongoing. You're doing an amazing job of serving those populations, but it's really burdensome on the free clinics and Lincoln and other safety net providers. We continue to have conversations with various groups in the community to determine whether or not we can establish additional testing sites in addition to the ones you mentioned. We're also pursuing the possibility of doing a mass testing event or a couple of those. So we'll keep you posted as we move forward. But I think this task force is doing an amazing job, and it's an honor to be a part of what's going on here. Thank you.
I have a question, Katie, for Phil and also for Rod around the percentage of positives. 50% is a very high number at Lincoln of positives. And I was wondering, Phil, if you had any more comments on that, and also Rod, what I know that we still don't know the full denominator that will provide us with our total positive percentage locally, but I wondered if you could also comment on our positive percentages.
I think the 50% number is just an indication of the fact that we cater specifically to vulnerable populations. We're catering to the individuals who are on the front line, those essential workers on the front line, day in and day out. So that number is consistent with what we see every time we look at the numbers that we test and the percentage of positive. Now, what is surprising is that African Americans, though they represent a huge portion of that vulnerable population, are still underrepresented in those numbers. But we have been warned by a couple providers that they're beginning to see some trends upward in that particular population. So we still have to be challenged to make sure that we maintain those low numbers for the African American community, while at the same time, we do whatever we can to make sure that we take care of the Latinx population. Incidentally, Lincoln serves a considerable number of Hispanics and Latino patients every year, close to about 18,000 unduplicated users. So this is a population that we've worked with community partners like Pilar, who has representation on our board, to serve this population.
Mr. Mayor, I would echo Phil's great sentiments in that the African-American community does continue to be underrepresented, but we have seen some data that shows that there's a increase as of lately, probably within the last 2 weeks, Mr. Mayor. The denominator continues to escape us. I continue to beat that drum very loud. I continue to report that we have about 75% of the electronic lab reporting data. I'm elated to tell you that at least we've been receiving that from the state. The state sends that to us on a weekly basis. So progress is being made. They have heard you in the chair loud and clear. We received that information, but it's not complete. And we will continue to move forward with asking for that information. Additionally, the state does have some semblance of what our total number is, and it's reported on DHH's website. But at last count, it was a positive prevalence for Durham was still hovering around 9%. And we're continuing to press upon them that the mandates that they're giving us mean nothing if we don't have that information to tell us exactly where we are. And for us to be able to pull that information and add it to our rich and robust data hub, so all of Durham can see exactly what that positive rate is, because not a week, not a day goes by that I don't get a resident, a citizen, or some interested epidemiologist to email me and ask for that information. And it's not a good feeling to be able to tell them that I don't have it, but the truth of the matter is I don't.
Thank you both very much. Appreciate it.
I just want to.
Should I just say, Bill, we know you guys are really on the front lines. There's so many people we talk about being on the front lines, but I've talked to people that work at Lincoln, and I know that you all are really not. You're seeing a lot of cases, and I know that's very difficult. And so I want to appreciate that work and thank you for it. And I hope you'll pass that on to your staff as well.
Thank you, Mr. Mayor.
I just wanted to jump in that I think with what we're seeing with the Recovering Durham effort that the Community Health Coalition is partnering on is just the importance of the public education component. The city, the county, and Durham Public Schools, we all pulled together our travel money, and we came up with $67,000 that we put towards that effort. And then they also got a grant from Duke for the same amount, 60,000 or maybe 67,000 to match that. And so that's really been really important because they are paying community health workers to go out into the community. And I think we really need to think about, I know you mentioned, Mayor, I forget COVIDtarians, but I guess thinking about the Latinx community, should that be the next step, that we're paying people, community members to be, health ambassadors, to be community health workers. So I think that would be one of my questions to everybody is, what's going to be the best way to really get a lot of the word out to the community, but related to, face coverings and best practices. So, and again, the city and the county have funds that are set aside for COVID for purposes like this. So that would be one of my questions to everybody.
Good morning, everybody. I would like to say thank you for that, because I think as I mentioned in the last meeting, we need to do more in-person outreach with the community. I've been asking different groups from the community. Not everybody feels comfortable going out. Some of them still want to be inside. So we are putting together like a calendar of different things we could do. So going out to the community neighborhoods, Latinx businesses, but also doing some videos, Facebook Lives with people from the community talking about all these different things. And also we've been trying to put together what is the information the community needs. So we talk about, of course, masks, how to use them and everything, but also a clear message, what is going, where you can get tested directly, not sending people to websites or things because people don't go. People want a telephone number or address to go directly. But also doing more research about where they are asking for IDs to get tested. And I think we've run to some issues with some CVS. So people can't go to those. But also, those resources, and I forgot the last part I was going to say, but putting together the package of things people need to be able to really comply and stop spreading the virus. Also the other question I had this week or talking about it is, I've had anonymous calls from businesses where they had one person sick with COVID, but not wanting to get tested or not wanting to say anything because they are afraid of losing their jobs, but they haven't seen the employers doing what they're supposed to do or testing. So the question is a possibility. I know it was mentioned about going to these nursing facilities and do a testing in the site. Is there a resource that we could do that if we know from one bakery, one restaurant that this is happening, offering the testing to the employees? So it's not relying on them trying to get help undercover, but really go up front and help them because I think it's for everybody's health. So.
Laura, this is Rod. Just want you to know Durham Public Health stands ready to assist. I know there were a couple of, over the past weekend, there were a couple of restaurant situations and businesses within the Latinx community that we were made aware of. And we had our environmental health director and his team to reach out to those areas because the likelihood that we've inspected or have some type of relationship with them is very high. So we stand ready to provide that assistance. And, again, I did raise this issue with Secretary Cohen when she was here, just letting her know that we had been receiving some mixed messaging as it relates to restaurants and certain businesses in terms of those employees who were determined to be essential and those who are not. So we flat out just asked for some clarity on who's essential, who's not, and some marching orders for those businesses in terms of releasing employees and forcing them to, not forcing, but encouraging them to stay home away from work. So I just wanted to mention that to you.
Thank you.
So Phil, I have a question for you related to the testing. I mean, you said about 50% of the testing came back positive. Could you provide some context around those numbers? Because when I think about 50%, if you have a population of 2, that means only 1 came back positive. And I know you guys are doing way more than 2 tests. So could you provide some context?
That's an excellent question. We're talking about 120 that were tested in the last week, and 58 of those were positive, and all 58 of those were Latinx.
Okay, thank you. That's helpful.
And just, we project that in the next week or 2, we'll be doing twice that number of tests every week. So we're still ramping up, staffing up, ramping up our testing here at Lincoln.
Okay, thank you.
there are other questions or discussion? If not, I will turn it over to Maticia.
All righty, thank you so much. So next we're off to roundtables. And in your briefing materials, you saw the reports from the roundtables that reported in. I think we had quite a few roundtables that did meet this past week and continued with their great work. What we are trying to do as part of the roundtable report out is provide you with a consistent report for you to consume, and so that we can spend our time as a task force focusing on how do we as a task force help the roundtables continue to move forward. So hopefully everyone's had a chance to read those reports. I read all the reports from the roundtables, and there were some concerns that were raised, and there were questions around, what's going to happen, what's Governor Cooper going to say, and I think we now know, what he said this past week. There were general concerns around communications and how do we continue to get the word out, and I think as a task force, we're continuing to work hard on education and communication. I also saw concerns about, just thinking ahead and how do we plan for if things don't continue to go into the right direction. So it certainly seems like the roundtables are having the right conversations. So I'm just going to open the floor up before I start asking questions to see if there's any concerns that you guys saw as you read through the roundtable report outs that you may want to have some conversations about. I do have one, and this is related to the restaurant roundtable, and hopefully we have somebody on the task force that participated in the restaurant roundtable this past week. One of the concerns that I saw raised in that report out was about a new framework for employees or staff that's been provided by public health and the reopening team, and there was a comment in there about that needs to be legally vetted. So I just wanted to find out from Brian or anyone on the task force that participated in the roundtable, just provide some context around that. And is there anything that the task force needs to do to help with that?
Hi, this is Anna Davis in the City Attorney's Office. I reviewed that document and sent comments back to Brian yesterday.
Okay. Excellent. So nothing to be concerned about in that document, Anna?
I apologize. I was trying to take myself off mute. There's nothing concerning. I don't think they're considering, the document doesn't contemplate all employer obligations under the Americans with Disabilities Act, which does govern confidential health information during the pandemic. It didn't contemplate all of the guidance that EEOC issued to employers during the time of the pandemic. So I did make those notations and try to give not specific advice, but general advice about some additional things they will want to consider to protect employee confidentiality, and also to consider the federally enacted laws under the Family First Corona Response Act, which requires employers to consider whether paid sick leave is due or Emergency Family Medical Leave Act is due for COVID-related reasons. And so they should consider whether those laws apply to them before they deduct pay for their employees who are out sick for COVID reasons. So those are the things that I highlighted that they should take into consideration to protect themselves as employers.
Okay, thank you for that, Anna. I'll point out another concern that I saw raised, and I'll ask Dr. Davis maybe to maybe spend a little bit of time talking about this. As I read the Places of Worship Roundtable, there is a comment about places of worship being a potential super spreader. I just would like to hear a little bit more about that and things that that roundtable may be doing to try and prevent that from happening.
Okay, thank you. That particular question did come up from one of the clergy members, and they were indicating that their health team from their congregation had been doing some research, and what they were wondering, and from their research, they were saying that churches and places of worship could be super spreaders, and that because of our role and participation, that clergy could fall into that category. And so that was where the question came up. Willa from Rod's department, she spoke that she really couldn't speak to that particular question with any detail. And Ryan mentioned that he would work to talk to the people at Duke to see if we could find some more information regarding that. So that was kind of the whole reference point of it. And we tried to still emphasize that's, well, for most people that were on the call, they were not, I mean, on the call, most are not open yet. There were one or two that I think that are, but they also are trying all that they can to practice safety as much as possible.
Okay. Thank you for that. Other items of concern that I saw as I read through the documents, I think there's a general sense that there's still some concerns from retail, and I think even restaurants, about just fear of returning to work, and that's coming from staff, of course, and just trying to continue to work through that and make sure that staff feel like if they're coming into the work environment, that they are safe. So I understand that being a general concern. I don't think we've spent a lot of time talking about the construction roundtable, and I do know that we've had some conversations around, social distancing when it comes to construction workers, and I saw some notes in there about sick leave. So I don't know if anyone on the task force participated in those roundtables, but would be interested in hearing more about, is there anything that the roundtable is trying to do to kind of help promote the social distancing in the construction industry?
So I was on just to listen to part of the construction roundtable this week. Not a lot of dialogue, I would say, but they are really trying to work on this. They've got a nice document that they've created that is in English and Spanish that promotes social distancing. The one comment that I provided back was that it did not have any reference to face coverings, and I thought that was important. And so, and particularly there was, and this is not something they created. It's something that came from, I think, a building association or construction association. But it talked about ride sharing, which, as we know, is common coming to construction sites. And instead of saying wear a face covering in the car, it was roll down the windows in the car, allow ventilation. And so I think there's more to do there. And provided that, certainly I'm not a clinician, but it seemed like that was important feedback to be able to provide to remind people around the importance of face coverings. But they seemed open to the ideas and seemed engaged. I don't, Pilar, I think you were on that group too.
Yes, and I participated in the other one on Wednesday. But again, we talked about the signage and changing some of the things. And also we were approached by a construction company to provide some information and education and materials to their Latinx workers. So we asked them, what do they think about it? And probably that's another way we are going to work with them, coming to the construction companies and sites. Because the other comment, I think, was from Indira from Duke Energy. She said every morning or every shift when they do the safety briefing, they are including COVID as part of it. So also including that, but we got the idea from this company who approached El Centro to do these trainings. So I think we are going to do actively these trainings.
Thank you for that. So those are the items that kind of stood out to me as it relates to the roundtables. But again, I just want to ask if any others have any comments that you want to share or weigh in on as it relates to the roundtable report outs or any roundtables that you participated in and we weren't able to get a report out.
I'll say
I'll
one.
lift up. Oh, go ahead, Susan.
One issue that I heard from the events and venues roundtables, that came up in a couple of them, was about an expectation that they may need to, or it might be good for them to take temperatures as people come in. And as you can imagine, if you tried to take temperatures of people coming to a festival, that's a lot of equipment, and they would need it one time. And so there was a question about whether there was a way that we could publicly invest in some equipment that could be reused, shared and reused for different events. I think if we anticipate that this could go on, and our even after things, some of the urgency of the situation fades, that we might want some testing available for the future, that something like that, investing in a pool of equipment might be a good idea.
Thanks for raising that. And I would say, as I think about one of the things I heard Mayor Schultz say this morning as it relates to trying to come up with a budget for the task force, those are certainly things that we need to take into consideration as we try and build out a budget. So thanks for sharing that, Susan.
I do have one thought, and just I'm the more we talk about construction, and on the immigrant and refugee roundtable, it was a big topic yesterday. And I really wish we could figure out, we've got to do something to get a better handle on the situation. I mean, it's so many of our cases. We know how hard it is because people are working out in the hot sun. They don't want to wear a face covering, understandably. They're in close proximity. We do have the travel problem. I know we have the paid, we have the the time off, the sick leave problem. And I know we've tried a lot of things, but I think we haven't tried enough. I mean, there's got to be some other answers to this that we can engage our employers, our subcontractors, and others in. I think, I keep thinking about the transportation aspect of it, which seems so hard, but, is there a way for people to be coming to work by themselves? I mean, I know that people need rides, but is that something we need to be thinking about differently? And is there any way to encourage that? Do we have any sense about how many people we're talking about in the construction, who are like actively working in construction today in Durham? What is that number? And I'm not sure, I have no good ideas. I've been racking my brains, as I know everyone has, but I do think it's the area where, when I think about where are we really falling short, it strikes me as the number one area. And also, we're falling short, not because we're not trying, because it's real hard. But I just want to put that out for us to, maybe we need to put together and, or maybe we need to focus more attention on that roundtable, or I'm just not sure exactly how to, but I just want to mention it as a huge concern that's with me all the time.
Well, Steve, I just to jump in, to me, a lot of it still goes back to face coverings, because, if we look at that great story about the hairstylists, in Springfield, Missouri, again, and we've got personal care open now. The main, and that's people being very close to each other, but the component there is still related to wearing face coverings and I think about our Latinx families, that it's not just the family member who's working and gets sick, it's what happens when they come back home. And we see it spreading within families who are living, large families, and living in close quarters, and they can't isolate. Again, what's the best tool we have is the face coverings. And how can we really, make sure people know that if you to wear a face covering at home if you've got a family member who's positive. It's really hard. I mean, it is really hard, but somebody said to me the other day, it's like, it's also, do you want to wear a face covering or do you want to be on a ventilator? I mean, I hate to say it like that, but we are really talking about, it's very serious. We're seeing, I don't know if I cut out when Rod was talking, but it's very concerning to see that we're seeing in our hospital population, younger people, we're seeing more cases under the age of 18. Our average age in the hospital now is 39. I mean, it is, we're really talking about a very serious choice when it comes to face coverings. And even driving in the car with somebody, wearing a face covering could really make a difference. So I just want to put that out there that, again, getting back to the education and making sure that people have what they need related to face coverings within their families. I'm not sure if we even know that we're doing that.
How about, would we consider recommending, say, face shields, especially for the ride to work and back from work, instead of just masks? Because we know that they're the most vulnerable population now that we're trying to assist. So why don't we consider that?
Or maybe face shields for outdoor work, because that's going to be more comfortable, right? If you're outside and it's hot.
Yep.
Well, it definitely sounds like we have some ideas that can hopefully continue to move us forward as it relates to what needs to be done in this space. And we'll certainly either try and drive it through the work group or the roundtable, or try and figure out, do we need to pull some additional resources together to really focus on this? Anything else from the roundtables? I think Ryan has something.
Yeah,
Saw you lean in.
I wanted to lift up another concern I heard from our festivals and special events. And so we have individuals that are thinking about events that are coming in the fall, and understandably they work on setting these things up far in advance, and they're uncertain about how to proceed in their plans. And I just want to lift up that question. I think, and Susan could speak a little bit more to this because she was in that meeting as well, that it was a question we were hearing. They were looking for greater certainty. Obviously, that's a difficult thing to provide, but I wanted to share that question and see if there were any thoughts or reflections from this group about how to speak to that question and need.
That's definitely a great question. And it's one of those, I think, with so much uncertainty, it's really hard to know with certainty, when we think things would be open more. But I think as a task force, if we could maybe spend some time thinking about, through what period we think things won't be open, because I think that provides some at least certainty through maybe that short duration, but we may not have the answer for the longer duration. But I think if we can at least have some conversations around that, that might be helpful. But definitely interested in hearing thoughts from others.
I wonder if George has any thing that since he lives in the world of big events, had anything that he wanted to offer.
I wish I did have something useful to offer, but I really feel like most of the groups and projects I'm involved with, they have plan A, plan B, plan C, based on what reopening looks like. And so there's a lot of angst, there's a lot of whining, but I mean, everybody sort of understands they have to have their plan and be prepared, and there's really no magic wand to be waved. So, I mean, everyone I talk to's got plan A, B, and C.
Yeah, I would add to it that, and our organization is trying to work with meeting planners, booking events from next week to the several years out. And it's a very difficult, and there is complete recognition that no one has a crystal ball on what's going to happen. But I would say this task force is very focused on what the current situation is today, what are the problems we need to address right away. To the degree that, and I think Maticia said this, to the degree that we can think ahead, and we may not be able to say, here's what's going to happen in October, but if we can say, look, there are definitely not going to be any events over 25 people in the next 45 days, or if there's any guys like that we feel comfortable making it the low point, the minimum threshold of what we would allow, even that is helpful. So wherever there's an opportunity to be forward looking, that's going to help the event planners.
We can certainly work to make some recommendations around that, just to provide, it won't be complete certainty, but at least it allows folks to look beyond or not sit and wonder, can we do something in the next month or the next couple of weeks? So we can certainly take that as an action item and spend some time working on that. All right. So if there's no other comments about roundtables, I'm gonna move us on the agenda. And the next item that we have on the agenda is just really open up to the task force members, just sharing thoughts or raising any other topic that we didn't cover on the agenda today that you would want to spend some time sharing or thinking about or getting feedback on. So I'll open up the floor for any other topics that anyone wants to engage in.
This is maybe just more of a nerdy question for Rod about the difference in cases cumulatively and active cases. It's interesting to me that Durham, more so than other sites I've looked at, dashboards I've looked at, reports the people recovering. And so there's more of an emphasis on active cases versus the cumulative number. But I don't even know how to ask this question, but what, as you're managing this crisis through these numbers, why is the cumulative number more important than the active number?
Good question, George.
Did that make any sense?
It did. Totally. Good day to you, George. Always good to hear your voice. I would just say, from a historical context, and Dr. Akinboyo can really weigh in as well, because we definitely are a team in this. From a historical context, that's just the way it's always been. We've always been fixated on the cumulative, because in healthcare, be it public health or hospital administration, we always look at the total numbers. But as we've said before, COVID has turned everything on its head and really required us to really look at other things and other aspects. For example, with lab reporting, George, we never looked at negatives. We would look at it sometimes, but we really fixated on the positives. Whereas COVID has really required us to really become more fixated on the positive and negative for that denominator. And everybody wants it. Being the eternal optimist that I am, I definitely want to report on the inactives, because that's our hope. That's what we hang our hats on. The fact that there's so many people who are truly recovering, but yet there's so much emphasis on the total number of cases, which at certain point is necessary, but it kind of emphasizes that that long marathon approach to how far we've come and the total numbers and everything. When you look at a Mecklenburg County, for example, 9,000 cases, 9,000. I have no idea, George and others, what their active case volume is, but I can imagine it's pretty high. But when you look at 9,000 cases, you just think, oh my gosh, that is so many cases. When in fact, they may have like thousands who have recovered, thousands who beat COVID. So I just make sure that I report the inactives along with the actives to also let my staff know that, yeah, we're in this fight. It's long, it's arduous, but don't think about the total big number. Think about that active, and that puts things into greater perspective. So I so hope that answers your question, sir.
Yeah, and I completely agree. I think you actually hit the nail on the head. What matters a lot. So the people that are most likely to be transmitted are the active cases. But I think the burden on society and the burden on our community is probably better reflected, and I say that hesitantly, but maybe better reflected with the total number of cases. So as a whole, we know our community has had to deal with this number of cases over time. But I do think we focus on the active cases, and we do it in a different way. I really like how we talked about contact tracing, the numbers that are linked to close contacts today, because the point is, of our active cases, we're seeing that a good percentage is related to close contacts. Doesn't mean we shouldn't get this down. It just means that the number of people that are getting infected are linked. So we know we can draw a map and say, okay, you went here, you were in this household, and we can link it up. What we worry about is what we're seeing, where some active cases are increasing our community sharing, where we can't link you, and it's really hard to prevent those community prevalence. So going back to what was said earlier, we have to ensure that that community prevalence, the unlinked cases amongst our active cases, continues to go down. So hopefully that didn't confuse you too much, but you're right on the epi track. We do want to keep track of active cases. We don't want to lose focus that our community has dealt with a lot more in terms of numbers. And if we're seeking resources, we have to talk about the overall burden and overall number of cases we've seen.
Great question. Thank you for that question, George. And thank you, Rod and Dr. Akinboyo, for your responses. Any other topics to raise?
I had one. I know we've been focusing on businesses and the vulnerable populations from a perspective of what can the task force recommend. The more we talk in conversation with just everyday lay people are kind of frustrated, and I know we're all hearing that. And only thing I've been basically telling, person to person is, find out something you can do. If you're tired of hearing all the things that you can't do, find out something that you can do, and hopefully it's something that you can do to help. Excuse me. And I'm just wondering if there's a recommendation or multiple recommendations from the task force that we can put out, I guess to everyday citizens on ways that they can engage and help. I know I was discussing this with Pilar, and they're in need of additional drivers to help deliver food to those that are quarantining. And I just, it's completely safe ways and things of that nature. And I'm just thinking, more and more, I've got a daughter who's just found out she probably won't be able to go back to DC to Howard for her senior year and have to do it online. And she's super frustrated, and just feeling, and obviously that's a small thing, right? In the case of what we're looking at. But what I've been just telling her as well is just, look, find a way to find some type of power in the situation, as opposed to letting life happen to you, so to speak. And is if there's a way that we can, as a task force, recommend something to Durham, right, on how to engage in a positive way. And I think that they may even help curb some of the the pushback, because for the last few months it just seems like everything that we're hearing is coming back to us, telling us what we can't do. And eventually, I don't know, human reaction or whatever, we'll begin to just push back on some of the most mundane things, just for to find some type of power in the situation. So I was just thinking, from a perspective of the task force, if there's something that we can say to recommend on how people can get involved and get engaged, that's it.
Yeah, I think that's a great idea. And I like that approach about let's stop thinking about what we can't do and let's really focus on what we can do. And I think the more you get folks engaged, I think the easier it makes our efforts, or the easier it makes our overall community efforts, because when you have a broader population of folks engaged, you've done a lot more education, you've raised a lot more awareness, and then people are a lot more willing to move in the direction that we want folks to move in. So that's certainly something that we can take on and make some recommendations, because if you think about the task force, that's why we're here. We are here to advise on ways that we can go forth and reopen in a safe manner. So I like that, and I'll log that as an action item for us to consider.
Maybe back on the Bull could have some volunteer opportunities. I mean, there are things like organizations like Meals on Wheels that are still operating only on a weekly basis versus daily, but they need help.
Yeah, the food bank as well, I think, is still very much in need of. I think there are a lot of organizations that do need help. I love that idea, and that could be a whole component of the work that we're doing. And it's as simple as linking people together, right? And linking organizations with volunteers.
Yeah, and definitely going back to when Susan was talking about the communications roundtable and the effort, sharing with all of our networks, everything, what is happening, why is happening, where is the need for help. Because Saturday I was in the Juneteenth census parade, and one of the volunteers was one, I think it's a nurse from the regional, and she came to talk to me exactly with the same, saying, I've seen more patients, Latinx patients, what can we do? And I shared with her some of the statistics and everything that is going on and the barriers. And I had no idea about this, and I know a lot of friends, family, neighbors who are willing to help, but we don't have all this information. So that tells me, and it's with everything, yes, we can't get to everybody, but as much as we share all of these, more people will know, more people are aware, and more people will be willing to collaborate.
In terms of the behavioral health component to this, the mental health component, I think that's a huge burden to the community. I wonder if we could get like Alliance. Alliance has been active in our roundtable, but if maybe we can get some recommendations from Alliance as to how we can address that component more comprehensively.
That's a great idea.
And I just want to jump in, Ed. I love the comment that you made. You're so right that, this is really hard. Everyone talks about quarantine fatigue, and, this is difficult. It's very difficult. Like you said, while I was in this meeting, I got a text from my daughter that she just found out she's in law school, and they just decided everything is going to be virtual for fall semester. It's really hard. But yeah, people, I think getting in touch with the human aspect of this, people do want to help. And I just want to point out that the Triangle Nonprofit Center has been actively, we're trying to funnel people to them to place people at helping with the food efforts. For instance, I think in the last 2 weeks, they've placed like 53 volunteers. So we also want to make sure we use some of the, you know, networks that we've got going. And related to that, you know, Steve and I were talking about, I think the census parade was a great example of how we can still keep building community, how we still can keep getting people engaged and feeling connected in safe ways. And, you know, Steve had a request for an event, a virtual event with, you know, how can we do it with cars? So I think we've got to be creative and think of ways that we can still keep coming together. I know for that's a big thing, I think, for the clergy roundtable. So I think we've got to, and related to events, you know, people have a need to connect and come together. And so thank you for challenging us on that, Ed.
I want to add one more note of concern, and then I want to say something happy and good. Some good news. One of the things that has been on my mind a lot, when I saw that the Hajj was canceled, except for people who are actually in Saudi Arabia, and I know that our high holy days at Judea Reform are going to be virtual. Jews have been coming together for the high holy days in person for some thousands of years that it's too many for me to know. And, you know, I think that I worry, you know, we don't know what's Christmas going to be like for, you know, are people going to be able to come together in church at Christmas? And so I just want to think about that as well. I know that roundtable is, but also kind of from the mental health standpoint, like Phil was talking about, you know, this is a tremendous sense of loss not to be able to be together for the high holy days. On the good side, does that mean I don't have to repent my sins over that 10-day period, which would be a good thing? But I am, you know, I just wanted to think ahead a little bit about that. I know our synagogue is, I know the congregations are, but just from the mental health standpoint, again, I just am so concerned about that. And I appreciate Phil bringing that up. One thing I didn't mention earlier, which is good, and I don't think anybody's mentioned it yet today, is that on July 1st, the council will be taking up, and I'm sure approving, the permitting necessary to do outdoor dining in downtown Durham. And this will be a great thing. Been a lot of work. Nicole's not here on the call today, but Nicole and Downtown Durham Inc. have led the effort. Susan and others of Geoff and Brian have been involved in a lot of our restaurants and our city staff. And so I'm really grateful for that. And I think they've got some really good ideas. And I think that we're going to be able to make this happen. So I'm excited. And as I say, I believe the approvals will come. The approvals will come on July 1st.
All right, thank you for that. Katie, were you gonna?
Nope, go ahead.
Okay. Now, I was just gonna, are there any more comments, concerns that anyone wants to share? All right, if not, I definitely won't try and make us stay on until 10 o'clock just to get to the 10 o'clock mark. Katie, is there anything that looks like Pilar may have something?
Yeah, no, I want to share, as Susan mentioned, we started or launched our communications campaign. And initially we put it out there and we were inviting other media outlets, Spanish media outlets to join the campaign. But greatly surprisingly, we've had other organizations, local government joining the campaign. So I will invite and I will send an email to the mayor and county commissioner share to see if, because already the town of Hillsborough Chapel Hill, Scarborough, Orange County have joined the campaign. And what it means is we will add the logo on the campaign, and then we will share all the information. We are sharing the graphics we are doing, so we can share, spread the word. But also, I think it's an outlet to, because initially the idea was also for us to share with this campaign de vuelta al ruedo, or back to the bull. So I think I will invite all of you. I will send you the email and the link if you are willing to join the campaign.
Thank you. All right. Again, we're at 9:45. I think we've covered everything on the agenda. I will, just a reminder for next week. Next week, we do have a holiday, and I think we have collectively agreed that we will take next Friday off, unless after hearing all the action items coming out of today's meeting, you want to meet, just let me know. But really encouraging you guys to, take next Friday off. I know work will continue next week, but just remember, we're not meeting on Friday. Really appreciate everything that everyone's done. And so while you are relaxing next Friday from 8 to 10, use that time to really recharge and think about all the great work that we still have to do as a task force.
And if I can just add in, we've also are recommending that the roundtables also take a respite next week. We really want to give people, we are about at our halfway point, probably. I'm not counting days, but we're about at the halfway point for the task force, and a tremendous amount of work has taken place, but there's still a lot to be done. So we want to give people a brief respite. We know the work will go on behind the scenes, but where you can, we would encourage that the roundtables also not meet next week, just to give people a bit of a break. And then we will be back in full force the following week.
Yep. And so just a couple of action items that I've captured from this meeting, and if I miss any, Katie, please chime in, Ryan, chime in, or others, please let me know if I miss anything. I think at the top of the conversation, at the top of the meeting, we did get some direction that we really need to work on coming up with a budget. So we will take that as an action item and make sure that we get that addressed. Just looking for other items that we've agreed on working on over the next, I would say week, but Katie did remind me, no roundtables are meeting next week, but over the, say, next 2 weeks. I know that was the biggest item I think that I got. We did have some conversations about how do we make a recommendation around provide some guidance for a festival and special events roundtable around the duration of when we don't think we're going to be engaging in any big events. So I took that as an action item. Also took as an action item for us to give some thought to how can we recommend engaging our larger community to help with maybe some volunteer efforts, but making sure that we're leveraging places that are already engaged in this type of work. So it's not a brand new thing that we're going to do, but how do we leverage the community as well as others that are engaged in this work to really help folks focus on the possible and not the impossible. I think those are the big items that I captured from today's meeting. Hopefully I didn't miss anything.
The only other one that I had was getting the word out about the face covering marketplace.
Yes.
Which is ongoing work.
All right. Well, that's all I have from this meeting. So I appreciate everyone's continued engagement to support this effort. I hope everyone enjoy your Friday, enjoy your weekend, and just playing along with the theme that I think Ed kind of brought up. Let's focus on what's possible and what's not impossible as we go through this weekend and through next week, and definitely wish all of you a safe and a joyous 4th of July holiday. So take care.
Thank
Thanks,
you.
everyone.